name's Philip Russo. I'm a Professor of Nursing at Monash University and also the Director of Research for Nursing and Midwifery. I also have a joint appointment at Cabrini Health as well as Director of Nursing Research at Cabrini. My nursing career started with my nurse training, which I undertook at a hospital, which gives you an idea of how old I may be. These days, of course, nursing is conducted through universities, and which I realised if I was going to progress in my career in nursing, I needed to go and do a university degree as well. So after having finished my nursing certificate in a hospital, some decade later, I undertook a bachelor's degree in nursing. I've also done undertaken studies in clinical epidemiology. I've got a master's in clinical epidemiology, and then I undertook my PhD some 10 years ago. I guess one of the main turning points for me and my career was very early in my nursing career. I was working on the infectious diseases ward at a large major hospital in Melbourne, Victoria, Australia. And it was at the same time when HIV and AIDS were starting to appear in our landscape. And so we were looking after all these HIV and AIDS patients, which really sparked my interest in infectious diseases and infection control. My big passion, and has been for quite some time, is being able to get reliable data on healthcare-associated infections in Australia. Unfortunately, Australia doesn't have a national system for this, unlike the States and the UK and many European countries. Hospitals have their own data on how many healthcare-associated infections are occurring, but it's really crucial that we try to get a national picture so we know where the infections are occurring and that give us an idea to inform our national infection prevention strategies. So some of my research at the moment is working with hospitals and using electronic medical records in trying to find efficient ways of identifying patients who have a healthcare-associated infection. One of the first things that made sense to me in the medical world was that of infection, how infections take place and how infections can be prevented. So it was very early on in my nursing career that my interest was sparked. The other parts, I guess, that drives me is that I have two very close relatives, both who have had surgical site infections over the past 10 years. So that has even driven me further to work in the surgical site infection space. Well, I've got 2 dogs and 3 chickens at home, so that keeps me fairly busy on weekends, keeping an eye on them and cleaning them all up. I don't have one particular hobby as such, but I do have a great interest in sports. I used to do a lot of sport as a youngster, particularly cricket and football, Australian rules football. Bit too old for that now, so I just tend to follow it on the TV, and I'm a passionate Test cricket supporter as well. I do like to have a bit of gardening, and I also like to do a bit of windsurfing as well in my spare time.